Hello everyone, welcome to Raaonline. I'm Dr. Abhinaya, I'm a consultant pediatrician. So next discussion will be on approach to a first episode of seizure. So we will discuss about an unprovoked seizure. We already have a presentation on febrile seizure, so I request you to go through that also. And so let's get started with this one. So what is a seizure? Let's start with the definition, isn't it? Simple. So seizure is nothing but a transient occurrence of signs and symptoms because of an abnormal, excessive or synchronous electrical activity in the brain. Okay, so it is a transient event and because of an abnormal, excessive or a synchronous electrical activity in the brain. So this is the term that you should use when you are defining a seizure. What is an unprovoked seizure? We know febrile seizures. Febrile seizures are fever related seizures, fever triggered seizures. Unprovoked seizure is something where you do not find a potentially responsible condition when the patient comes to you, or there can be a pre-existing brain lesion, like the child could have had an HAE event at birth, but now maybe at 4 years or 5 years the child is throwing a seizure. You cannot attribute this seizure now at this age to a HAE event that had happened during the child's birth, isn't it? So beyond the time interval which is recognized for an acute symptomatic seizure, if the child is getting a seizure, that is also unprovoked. Okay. So most often in the clinical practice, in our clinical practice, usually we see febrile seizures till the 5-year mark, and beyond that we get to see a lot of unprovoked seizures. There is no inciting event, and after a history, after the history taking, we will not be able to identify the trigger. So it is an unprovoked seizure, and there comes the challenge. So what are the investigations that you are going to do? Should you start on anti-seizure medications or not? So that is the challenge, isn't it? So acute symptomatic seizure means there is a systemic illness or there is a brain insult. Brain insult like HAE or a hypoglycemia, say in an infant, or an acute systemic illness like a fever or an infection which has triggered. That is an acute symptomatic seizure. Coming to the ILAE's 2017 classification of epilepsy, first we will talk about the definition and then we will go on to the epilepsy classification. So the definition of epilepsy is, it is a brain disorder which is characterized by an enduring predisposition to generate seizures. Okay, so the brain has a predisposition to generate seizures. That is an epilepsy. So it is a disorder of the brain. So the entire definition is, each and every term is important. A disorder of the brain which is characterized by an enduring predisposition to generate epileptic seizures. Operational definition, this is the definition given by ILAE, but the operational definition is, if there is at least 2 or more than 2 unprovoked seizures more than 24 hours apart, that will become an epilepsy. Or when there is one unprovoked seizure and you do an EEG, you find that there is an epilepsy syndrome. So you find that the child is probably at a risk of getting further seizures. So there is a recurrence risk. So in such instances, you can label it as an epilepsy. Okay. So the first definition that came is a theoretical definition or the textbook definition, which is disorder of the brain which is characterized by an enduring predisposition to generate epileptic seizures. Operational definition is 2 or more than 2 unprovoked seizures 24 hours apart, or 1 unprovoked seizure has occurred and there is a probability of further seizure similar to the general recurrence risk. Okay. So this is the classification of epilepsy. So there are seizure types based upon the semiology. You can classify it as either focal or generalized, or you don't know, it is unknown. Okay, so based upon the seizure types. Epilepsy, once you have done all the imaging and the EEG, you will come to this classification where you can term it as a focal epilepsy or a generalized epilepsy, or it can be a combined or unknown. Okay, and last comes the typical age-related epilepsy syndromes. Okay, so the etiology of epilepsy can be many. It can be structural, some focal cortical dysplasias, MTS. So these are all structural disorders causing epilepsy. It can be genetic causes of epilepsy, like Dravet. There are many genetic causes of epilepsy. So identify a particular gene. Infectious causes are there, like neurotuberculosis, metabolic causes of epilepsy, immune, and finally unknown. So these are some of the etiological classifications that you will see.